So this is
Anyway,
going to be a very relaxed
okay.
conversation, and I don't want to make it sound very, very formal. For those of you that do not know me, I'm Diana Girnita. I founded this group on Facebook called Specialists for Direct Care a year and a half ago. And the purpose of the group was to connect people that are interested in direct care or practicing direct care, because we were just a few of us across the country, but we were not interacting to each other, and we were all hungry to connect to each other, but we didn't have a space to connect. So like everybody else, we started this group on Facebook, and we started to connect, and we have developed beautiful relationships. That's how I met Hayley. Dr. Miller, who's here. She is an endocrinologist, as many of you probably know. I am a rheumatologist, as you probably know. But Hayley started probably, and correct me if I'm wrong, I think this is the first direct care specialty endocrinology practice in her city, if not in her state.
Definitely in the state, probably in the region, like
Probably.
in the 10 states where I practice, it's probably the second.
That's great.
Yeah.
And Hayley, just to give you a little bit of background about her, she has an undergraduate degree in nutrition and food science from the University of Wyoming. She did her MD at University of Washington School of Medicine, and she completed 2 years of internal medicine residency in La Crosse, Wisconsin. And then she went on a fast track fellowship in endocrinology, diabetes, and metabolism at the University of Utah in Salt Lake City. So Hayley, tell us a little bit more about you, and then I'll start asking you some questions. And in the end, I would like you to join me in asking Hayley questions.
Awesome. Yeah. Thank you so much for having me. And I'm sorry, I do have a tendency to be late to a lot of things, and I'm working on it, but it's not as easy to kick that habit. And I've worked really hard today. So I am in endocrinology. Diabetes has been kind of my thing since before I was in medicine. And I've always really wanted to provide really comprehensive care to people with diabetes. I've had type 1 diabetes since I was a kid, and I know what good diabetes care looks like, and I know what bad diabetes care looks like, or like insufficient. And so like my dream throughout my entire career, basically through medical school and residency and fellowship, was that I'm going to be this awesome doctor. But, you know, as we all know, you go through training, and really throughout the course of my training, appointment times got shorter and shorter. The productivity kind of metrics went higher and higher, and the ability to provide that kind of quality care really was compromised. And I ended up being just flat, completely burned out and pissed off most of the time, like really ticked off and just like, this is crap. The moral injury of asking to really compromise the quality of care for patients in order to take care of more patients and bill more seemed really problematic. And so I started and stopped making, like, I was like, I got to do this, because I went to this talk, and Phil Eskew and this other kind of random guy in Wyoming were talking about direct care, and I was like, these guys are crazy, but it seems really interesting. And so I was like, oh, I'm going to start. And like, I was a lurker on the DPC docs board for probably 2 years, and I'd go and get started, and then I'd stop. And, you know, my husband is kind of he's the one who's on time, who keeps everything orderly. And he was like, that's too big of a risk, too big of a risk. And really, if you ask anybody who's around you, they're all like, oh, that's crazy. Why would you do that? But after kind of reading a bunch and seeing that there are other people who do it, particularly in the specialty field, I was like, you know what, I can't do this. It was either leave medicine, I was going to go join industry, maybe do research, something where I wasn't being employed and paid to work on a conveyor belt, or something else. Like it was kind of up in the air. But I like started working on it, and I tell you what, it's weird. And people talk about this, and people are like, oh, I had this awakening and everything's so wonderful. But like the stress that I have now is, it's just like such it's an infinitely different kind of stress. And it's like stress and dissatisfaction, and that is all completely gone. Like, and everything, when I opened in March of 2021, I do primarily diabetes care and some thyroid. I also do weight loss. The practice grew. I have telemed or virtual assistants, and it's just glorious. It's the world's greatest thing. So that's a very
Excellent.
long introduction, but
That's very, very good, because you answer my first question. Why did you went to direct care? That was the first question. And I
yeah.
think you answered that beautifully. Hayley, I know this is a journey, and everybody that is here has to understand that we gonna have, when we start into direct care, it's a huge learning curve for all of us, trying to figure out as a specialist how to place your services in this world where specialty care does not have the luxury of having referral system. That's something that took me a while to understand. And that took me, actually, that was the most important thing that I was able to understand going into direct care. So when you started 1.5 years ago, 2 years ago, did you have a mentor?
I would say, I mean, I would say not a specific mentor, but there was a constellation of physicians that I met that provided mentorship. So, because when you're creating your own practice, you want it to be yours. Like, you don't want to do it how everybody else does, and everybody does things slightly differently. But I had someone who mentors doing, like, I want to do telehealth and in-person. And so, but there are people who do telehealth and they can provide that kind of mentorship. And then there are people who do in person. And so it's kind of pulling from that list of different resources. And even though I wouldn't say this one person was really who I followed and did everything, there was definitely a significant amount of mentorship or mentoring. It's just all the doctors that graciously provided their kind of feedback and information.
And of course, like everybody else, did you have challenges, right? You have challenges in the beginning. What were those challenges for you in the beginning?
There are lots. I mean, there's so much that we don't know. And, you know, the first, like every day or two, I'm like, oh, I can't do this. There's no way. I can't figure this out. This just seems like too much. And every few days I'd have to stop and say, now, wait a minute. I can do this. This is something that other businesses can figure out. It seems hard now, but I will figure it out. And really, all the stuff that seemed like it was overwhelming and challenging and scary, and it seemed like stuff that was almost insurmountable, where it would be really easy to just hire. I wanted to keep my overhead as low as possible to keep the costs down so that I could provide the affordable care. And really, you know, I'm a doctor. That means that I'm not a dummy, and I can actually learn things fairly well. Like, I'm not doing calculus or doing those kinds of equations, but I can figure out how to run a computer, keep a ledger, use QuickBooks, set up an online scheduling system, and figure out a new EMR.
Yes, I think that you're right. In the beginning, when you look at the list of things that you have to do as a physician, we are used to just see patients and write notes and, put the right code, it seems to be overwhelming. And I have to share with everybody that even creating the website can be done by yourself. I think Hayley did that in the beginning. I did that in the beginning, and it wasn't pretty, but it was done. You have to understand that coming together or putting these things together for you, it is challenging, but it can be done. As Hayley said, give yourself 2-3 days and say, okay, I cannot do this, but I can think about ways of doing things, and you will find solutions to these problems. Or, choosing the right electronic medical records. I changed 3 three electronic medical records before I found one that I thought it's good for me at that point. It's still not the best, but still, I try to find solutions for all my problems or all my, I wouldn't call them problems, I would call them challenges.
Yeah.
And you will find solutions for those challenges. And now thinking that you are, sometimes into this business, what are the challenges now for you?
So I just want to go back and give a different answer to the question that you just asked really quickly, because the number one biggest challenge that I had with my business, the biggest one, and it sounds crazy, was just picking a name. It probably took me about 2 months.
Yes.
And I polled and asked and polled and asked and polled and asked. It's that kind of decision. And then it's like, okay, I picked a name, we're going forward. I think now the biggest challenge is time management. And I want to use my expertise and to maximize my business. And my expertise is in medicine. And I am at a point now where I don't need to be doing all of the tiny little kind of minuscule tasks. I can outsource them. I have 2 nurses that work with me based in the Philippines, and I pay my son to clean my office. And that was a little bit of a struggle at the beginning too, but getting it to where I'm not going and having to do all that kind of stuff. It's just finding people to do the things that aren't necessarily adding to the quality of care that I provide.
How hard was for you to give up the things that you have been doing and to pass or delegate things?
So I think for cleaning, it wasn't that hard. It probably was. I can tell people how to clean a lot better than I don't particularly love doing that. But I know that that's the minor thing. It was actually much easier than I think most people expect, even though I tend to be very controlling. I have a certain level, once you know someone, you know that you can trust them. It's kind of seeing what they do. And, I really lucked out. Everybody was talking and I'm like, I'm probably going to have to hire someone. And so, based on everybody, they were like, okay, you need to submit your application so that you can get someone through this service. And when I interviewed, I was like, I better hire her now because I don't want to have to wait another few months. And she really grew with me with the practice and made it to where I could grow a lot faster than I would have been able to had I been functioning independently. And so giving over, like, she's not doing medical exams, but she can do refills and she can do triage, and she's an RN who's very well trained. And so it's just kind of, and she also knows to ask if she doesn't feel comfortable with her scope, she'll say, hey, what about this? What about that? I think it's just finding the right person that you can trust.
I believe so. So they, there are people that we can train to do part of our job, and we can, put our mind towards other places and other scopes for the business. Now, do you have a business background? Because that's the question that I get all the time.
No, my dad owned his business, but I was afraid of going to his business. So it's not I have none.
No
0.
business background. Okay. But you figure out ways to learn and understand the business process. So I am going to take some questions from the people that are here. And one question is related to, at what point in the process of starting your practice have you considered hiring a healthcare specialized attorney?
Probably at the beginning. And I think that it seems like a big risk because we're trained, and with training, we're kind of led to believe that you can't really do it alone and it's too big of a risk, and you really can't do it without the attorneys. And I feel like that was kind of my belief. I asked different attorneys, and then it wasn't so direct care there weren't any laws in Montana to regulate it. And so when I went to the attorneys who were considered healthcare attorneys in Montana, they had no idea what it was. So they couldn't provide any kind of guidance or anything. I spoke I researched it, and, you kind of consult with the different attorneys that say that they're available on the platform. But I didn't, I started with a shoestring budget and bootstrapped the whole thing. I wasn't going to pay $200 an hour for someone when I wasn't bringing any money in, because those costs can add up really quickly. And so I haven't needed to hire one yet. The contracts have all been legally kind of reviewed. And they come from a book from someone else who had them legally reviewed. But like I spoke to a healthcare attorney the other day just to see about a moonlighting job that I could do, and would it be a conflict with my current business? And that's kind of it.
Sure. So for those of you that did not start yet in direct care, when you build up your practice, you have to be open to this possibility of taking moonlight jobs or taking a side gig job or something, looking into options to increase basically your revenue, not to affect your family budget. And I've done that. And I think every single one in direct care, when we started our practices, we have done that. So it's not a shame. I had to remain in Medicare because most of the jobs that you will take in medical jobs, they do require you to be still in Medicare, just FYI. And I think, Hayley, you do have a hybrid practice. Is that correct?
Yeah.
Tell us about that, because a lot of people, they are very interested how they can work with Medicare, but also with other type of insurances.
Right. So I want to make sure that just looking at who's on the board. So here's the deal. If you're on the DPC docs board, hybrid practice is like a bad word. Mm-hmm. And so if you do that, you get these, literally, I had some people who were like saying, if there was this massive, like, almost like bullying kind of, you're doing this, and why would you do that? And for some people on that board, it's like, it's either completely DPC or nothing. The thing is that part of that has to do with the function of them trying to push different laws through. And that's okay. They have a different agenda. But your practice is your practice. And I live in an area where a lot of the Medicare patients for whom I provide care are lower income, for one. And for two, there aren't any other, there was one other DPC, and they were in urgent care in my region when I opened. And it seemed like a really big risk to say, I'm an internal medicine trained diabetologist. Like I'm an adult, I take care of old people basically. And I'm just gonna assume that for 2 years, this is going to work. Like, it just seemed like too big of a risk. I didn't want to throw that out there. So initially I was like, okay, I'll just not take Medicare patients. And that I was like, no, I can't do that. And then I decided I'm going to start billing. I just started billing Medicare, and it's really easy. I don't pay a biller. I can code all the visits. I get paid consistently. I know exactly how much to bring in. And really, because I am in endocrinology and diabetes, and there's a lot remote patient monitoring in that, I can generate a monthly revenue for those patients. But there are also other options that aren't really discussed on the board that I learned actually just in this 15-minute conversation with the attorney the other day, that you could do non-parity with Medicare, charge a fee, the patient pays you, and then any billing that you do just gets reimbursed first to the patient. And so there are options, and that's one area where if I could look back, I would have spoken with this attorney to set it up slightly differently, just so that it would probably have increased the monthly revenue that I was able to generate initially.
All right. Can you tell us a little bit more about that?
Not much, because I don't know. Because
okay.
I set up, and she was like, oh yeah, you could do it. And I'm working with another provider who's doing it, and it's like Medicare concierge, and you have your contract is not something about I can't even remember the word.
I have to tell you from my experience that most of the lawyers that you talk to about direct care, they will advise you against doing a concierge practice, but
Mhm.
towards Medicare patients. But there are many, many physicians that they do concierge practices, not only for Medicare, but also for other insurances. And their practices, they thrive because of that. They give more time, they give value to the patient, and the patients are very appreciative, and they are willing to pay that concierge fee. So just to have that in mind, I don't think you should completely ignore that.
Yep.
Somebody is asking us, where do you find lawyers specialized in direct care? I have a contact for someone specialized in direct care. There are some lawyers, there are very few lawyers specialized in direct care, and there are very, very few that understand direct care. It took me a year and a half to find someone that was actually somehow knowledgeable about specialists. They knew about primary care physicians in direct care, but for specialty care, it's a little bit different than for primary care physicians.
So who do you use? It's because the gal who I was talking to, she's licensed in 2 or 3 states. But then I was like, so can you provide me advice? And she was like, not about your specific state, but the general principles are the same for everybody because it's federal law. And so there's a group of these attorneys who seem to be like banded together, and they provide, I don't fully understand it.
I have one in Colorado.
Is it Apollonia?
Apollonia, yes.
Yep, that's who I.
Yes, Apollonia, and then I talked to Phil Eskew multiple times, but he's very, very conservative. So,
Yeah.
and then I have talked to another lady that I don't remember her name, but then she was not very responsive to messages, and so I kind of quit her. Yes,
Yeah.
Apollonia Udell is the one that I think she's very good about what she's doing, but she's, she has to understand what you want to do,
Right.
and you have to sit down with her to make her understand what you want to do, or what you will envision yourself in a couple of years. Now, other questions are related to, do you have issues if someone with an HMO plan will need a prescription? And the answer is no. Everyone from an HMO, you don't need, many are asking me if I need referrals from patients. I do not, because I don't care. I don't bill their insurance. The referral is made just for insurance companies' purposes to justify the need for a specialist.
Yeah.
But other than that, your patients or the patients that will come to you, they don't need to provide you or show you a referral.
Right.
How about Medicare patients?
So far, no. I mean, I live in Montana, and I don't think that there are HMOs here that I'm aware of. Or at least they're, it's kind of like, we'll cover people in Montana, or we'll cover this group or that group, but that's not been an issue. I think the bigger issue is Advantage plans, because I know how to bill Medicare. And I don't want to do a bunch of extra contracting because that's a pain. And so I'm contracted with Medicare, and like the local Medicare, like the BCBS Advantage plan, that's it, because they pay the same amount. The other plans, it gets a little bit tricky because then you have to go in and submit the stuff, and it takes a little bit of extra time. And so I don't take any new Advantage plans. And actually right now I'm not taking new Medicare patients because I have an adequate number of patients to where I can be a little bit choosier.
What is that number?
Right now I have about almost 300 patients. And there are lots of new patients that come in, and that I think it's a good number. My goal is 600, but right now it's kind of a nice little number. It's the summer. I want to spend time with my family too. So
excellent. You have 300 patients in your practice, or do you have 300 patients, Medicare patients?
Oh, no, 300 in my practice.
Excellent.
Not,
Congratulations. In
yeah.
1 year, that's a huge achievement.
Yeah, thanks. I mean, it's okay. It's good.
It's great. So I have to ask you one question. Do you think there is a role in amplifying our voices and becoming together as a group of specialists that speak up that direct care exists, and that will apply to other physicians, but also to patients?
Yes, I think absolutely. Because the thing is that with me, if a patient calls and needs to get in to see someone for diabetes, they can get in to see me usually within a day or two or a week. It kind of depends on the week. But if they're going to the local group, it takes 6 months. And patients want access and they want to be heard and they want to be, and really the people who are sending, like, if you look at the two systems, they want their patients to be seen too. They don't want it to be in 6 months. They want it now. And so I get a lot of referrals locally from other providers just because they know that they can get the patients in to see me. And because they want their patients to be provided that kind of a more comprehensive care. And I think having that accessibility makes other providers a lot more likely to send the referrals. It takes a little bit of time for them to understand what it is exactly that I do and how it works. But I think that we need to highlight the visibility of the value of direct care to both providers and to patients, and the opportunity for direct care in specialty medicine, because it then opens it up to where it's not, people going out and creating their independent practices don't feel like, oh, I can't do it because no one's going to talk to me. And to also show providers like myself that are like, I just can't do this anymore, that no, you can do it, and you could do it better if you do it on your own. Personally, yeah. I think if we do this, it will drive all of the organizations to make sure that the panel numbers are smaller, that the time with patients is longer, and the amount of time that we can spend individually with each patient and use our brains and think adds a significant amount of value. And the more of us that do it, and the more we kind of get together and talk like this, the more data we can accumulate to prove that this method of care is superior to the others.
Yes. When I started direct care, people were asking me or were telling me that this is a disruptive way of doing medicine. And I always corrected them and I said, no, this is an alternative way of doing medicine. We are not reinventing the wheel. We are coming back to the roots of medicine. Right. We are not disrupting the system. We are here to provide what we know the best, patient care, and in an environment where we don't go crazy and where we do, like you said, we do the best that we can. There are people, many of them, including friends of mine, that left medicine for good. And I'm really sorry to see that, because I know how hard they worked and how hard they put their soul for their patients, but they couldn't take it anymore. And they did not have the courage to try something new. And I'm always amazed by people like you and many others that they had the courage to speak up, and also they find time to help others, because that's what we are doing here. We try to open the minds of others. We try to bring others to our side, if I could say so. Mm-hmm. We try to show them that we have the alternative and we can prove that we are able to survive. And many of you that will try direct care, one day you will thrive in your practice like Hayley does in 1 year, which is unbelievable. And I would like to invite you, that the people that are on the call, to ask us other questions.
So a new diabetes patient are scheduled for an hour and a half. Mm-hmm. It depends on the patient, and usually, so the way that my workflow works, because I mean, there's a lot of stuff that I don't have to do. So I have 2 VAs. I pay them. They're both RNs. one lives in Cebu and one lives in, I can't remember the name of the town, in the Philippines. They're both just like, they're two of my most favorite people. And I have a husband and kids, so we don't tell them that they're not watching this right now. So our protocol is that they will request all of the records from previous clinicians. They'll populate the past medical history. They'll make sure that the medication lists are up to date. And so we have all of that. And so before I see the patient, I can look and say, okay, this patient has all of these different things. It looks like it's going to be a longer visit, and I can block the time a little bit longer.
Sure.
But for the most part, every visit that I have is at least an hour, scheduled for an hour. And most the new visits are all 90 minutes at least. And if they have multiple problems and multiple things that we're going to be addressing, or if it looks like I'm going to be like starting 5 new different medications, we'll make it 2 hours, which is great.
So that's great. Somebody is asking, how do you manage when you are on vacation? Or when
so this is where my nurses really come in handy, because they're both RNs, and they both, I mean, they read all my notes, they do every prior auth. And one of the things I think that adds a lot of value for my patients is that I can get most of their medications, really expensive medications, inexpensively for them, and they love that. And these gals know that they text or call or message and say, hey, what do we do? So my nurses triage and handle and manage most of that. I don't go on vacation in places that don't have cell service very often on purpose. And it's just, I'm just a little bit more of a city mouse. So I always have my phone, and I don't mind looking at my phone and saying, hey, do this, hey, do that. And I can message and say, hey, you need to do this, and text my nurse, and she'll call the patient and get it done, triage everything. And if I have to, I could even hop on a call with them if it were an emergency. But for the most part, we haven't had that kind of issue. The number of emergencies that happen after hours or while I'm gone is fairly rare. I still hop on and look and check the messages just to make sure, because I don't want to leave any patients hanging. But I'm kind of, I always have done that, no matter where I go. So they can triage and do that a bunch. I don't have someone covering for me, and I don't mind it.
Do you think that being in direct care is a service that you have to provide 24/7? Because that's also a question that I get all the time. Will the patient bother you 24/7?
No, I was expecting that, because when you're in part of a group, and when I would work on call, like when I did fellowship, I mean, you always had those people who called at like 5:05 to report their blood sugar of 214 or something like that. And it was brutal. No one calls me. And sometimes I'm like, dude, you should have called me. This is something you could have called me about. I would have taken care of that. I could have helped you with this. But they're very respectful. And I would say that the number of even after hours calls or messages is so exceptionally low that I probably am encouraging people to use it a lot more frequently. And I think part of that comes from them knowing me and know it, like they have a relationship. And so they feel really comfortable with me. But it's not like they're every now and then you get someone who wants to send you pictures of their cat.
But that's because probably you spend enough time with them in the visit, answering all their concerns and taking care of all their problems, the list of problems that they come from. And because you spend that time, they don't need to bother you after hours. Now, a lot of the questions that I get is, how did you set up your prices? What was your point of reference?
I looked at everybody's websites. And so the first thing I did is look at everybody's websites, and I'm like, how much would I be willing to accept? The second thing that you do is you think of how many patients would you like to have, your max number, or like what's your goal income divided by the max number of patients that you think you could handle and the minimum number of patients that you can handle to get to that income. And so you do all that kind of division. And I did both of those things, but then it turned out that I was just like, well, this seems like a good price, so I'm just going to start here. And I mean, it works well. It's not too much. It's not too little.
Did you
I
raise
don't,
the prices after a year?
I haven't yet, no, but it's most just because that's will take a bunch of different messages and like adjustments, and I haven't had a lot of time to do that.
Sure.
I have a lot going on in like my family, and just as a human being that have needed me to kind of like focus, and I'm trying to exercise, you know, I have a lot of different things, but it's
You
just
have
hasn't been a
other
priority.
priorities.
Yeah. Yeah.
That's
I want to
good.
have like a life too. So
That,
it hasn't been something that I felt that I needed to do.
sure. Um, so somebody started the practice recently, and it's Chaya, why don't you join us and tell us about your recent experience, because you just started, and I remember when you joined my calls and you were asking questions.
Yes, yeah. Thank you, Diana, for organizing this. And hi, Hayley. I've seen several of your posts on DPC Docs as well as here at Direct Care Specialist. I am residing in Fresno, California, so that's Central California, very different than Northern California, where Diana is. Yes, I jumped into this model after doing the fee-for-service private practice for last 8 years. And I had actually attended Diana's initial sessions on EHR when she had just started the direct specialist group on Facebook last year. Anyway, long story short, I decided to create this direct endocrine practice, and it was October of 2021. Started seeing patients in January. It's been very good. I couldn't inform any of my former patients because the practice is just a mile away from where I was working previously. But gradually, it's been getting better in terms of volume or number. And I would never, ever go back. It's that appealing, it's that fulfilling, and for patient and for myself. I had, one question in which a couple of us newbies have been encountering, and we keep in touch with each other, is just the growth. It feels organic, definitely. I'm not paying myself, of course, and barely meeting my overhead, which is quite less. I do have an office which I lease. But in terms of, just getting that balance, how long did that take just to spread the word? It's very difficult to even explain the concept of direct care here. We don't have any DPCs around 150 miles.
So, I think that it comes from partly an elevator pitch and practicing. So when I first started, I was in this book club with these other DPC docs, and it was listening to the one-page marketing plan, and I read half of it, and then, it's kind of how it is with those books. It's like, well, I can probably figure this out. There's a worksheet and I just have to think about that, but it's the elevator pitch, and this is what I do, and this is what I do, and this is what I do. So having that introductory meeting, that meet and greet, probably makes a difference for that, because people are like, I don't know about this. What about this? The other thing is making sure that the people who answer the phone for me know exactly what to say and the things that patients are worried about. And really, I think when you're looking at your particular specialty, what is the reason that people are coming to you, and what is the reason they wouldn't come to you? Most of the time it's not for cost, but they don't really realize that, it's like, you're welcome to go to the other hospital. You can wait for 6 months to get in to see them. You can see the doctor once a year. You'll have 15 minutes with the nurse practitioner or the PA every now and then, and that's it. Like, you could do that, but when you message, you get me. When you have a question, it's me. And so far, particularly in the specialty, like the more specialized patients, they won't give that up. They would give up probably their Netflix account or something else before they give up that kind of service. But making sure that the referring providers know that. And then I would say, some people say Facebook, some people say Instagram. I personally don't do, I have my nurse do it now. I had another gal that I paid to do it, but she got a different job, and I'm just too old, and I don't like to take pictures of myself. But she does it, and that it seems to help. I think reaching out to smaller underserved communities also makes a difference. And that has been a major source of growth for me, is I go to this small town for outreach and it's like this just desert and no one comes down there and they send everybody to me. And then word of mouth is the other thing. Now, when you have a non-compete, there's certain things about non-competes, and I don't know anything about California's law, but I think that you can't advertise to them, but they can find you. And if your patients from your previous practice know you, it's just making sure that they can find you. And that has to do with SEO.
Sure. I have to share something with you as well. I don't think social media will bring you patients. And I can tell you that after 2.5 years of practicing in direct care. So it's good to have a presence on social media, but don't dream that social media will bring you patients. The patients will come from word of mouth, and they will come from Googling you. So
Yeah.
or Google will generate you patients in direct care. And the other thing that you have to know is that the first interaction that they have with your practice is your website. Make sure your website says it all. They don't read it all, but then the patient will call you to find out more. And I think the meet and greet is also valuable, especially when you begin the practice, because in this way, you are the best person who can explain to the patient what you are doing. And yes, it's hard for you as a physician to answer phone calls, but there is no one that will do a better job than you, especially in the beginning. And give them 15 minutes of meet and greet. Listen to them. They want to be heard. That's what you have to do. Don't jump on asking questions. Let them talk. Find out why they are coming to you. Try to understand what is their problem and then offer them a solution, because that's what they want, to be heard and to see that they have potentially found someone that can help them.
Absolutely. And the meet and greet to me at the beginning was really tough because it'd just be randomly scattered in. And I didn't want those patients to be put into the EMR because then it's tracking people who aren't my patients. And so we set it up to where we have a Calendly meet and greet kind of schedule. And then I have an hour blocked at the end of the day, every day for a meet and greet. And I'll say that I think that I've had only one meet and greet that didn't convert. And it was the only meet and greet that I didn't do a video visit with. And there were some different things about the visit where it was like, I probably wouldn't want them to join the practice because of just for different characteristics for the patient. And so I think that makes a big difference, and offer that free, or you can have like that funnel free tip. I'll give you a free something, that's just so that people see the website. It's that click. And if they can talk with you, it's just like interviewing, right? If you can just get that interview for med school, you can get in, right? But it's just the interview. That's all you need. And that's kind of the way that I look at it.
Hayley, thank you so much for taking the time. What is your advice for these people looking into direct care?
I think ask the people who are doing it, do a bunch of research and know that it can be done. And yes, it's hard. The first year is tough. I moonlight on the side. I love the moonlighting gig because it's really easy and I can just do it, as I'm sitting there. And so that pays my bills, and I'm not as worried about paying for anything. But know that it can be done. It just is slightly different than you might expect it to be. And that's, I guess that's it. I don't have anything profound that I can say because I'm not a profound
Is anyone
speaker.
here? Does anyone here have another question? No. So
Hi, I would have a question for you. Hi, I am planning on starting a nephrology direct care practice, and I was looking on the Facebook page, and there aren't many nephrologists on your page. And in nephrology, majority of the patients do use Medicare, and I am considering using, doing a mix like you are doing, billing directly to Medicare, but I don't know where to learn how to bill. Like at the hospital, it's easy through Epic. I just bill through Epic and the biller does everything for me. But this time, I don't know where to start. So where did you start with learning how to bill Medicare, or, you know, that's why I was having all these questions about the healthcare lawyer, because it
Yeah,
seems like it's very complicated using Medicare, and sounds a bit scary to me.
it does. It seems like it.
Thank you.
For me, I've there are certain codes in diabetes. Like diabetes, we don't have procedures. We have, it's mostly face-to-face counseling and coordination of care, and then diagnostic CGM and labs. I don't read DEXAs, and I don't do thyroid biopsies. I've always wanted to do just diabetes, and so neither of those were things that I even pursued. And so I knew how to code that because I've had to kind of lobby different hospitals how to code those things. But the rest of it is research. Now, there is a great resource that you can, like, if you think of whatever it is, you Google what is the CPT code for this, and then you go to this Medicare fee lookup, and then you pick the maximum amount, or the amount of money that you can bill, and then you pick the code and you put it in, and it just kind of depends on your EMR. And I just went through and made codes for each one, and it's kind of Googling and looking and seeing what I can do. And it's piecemeal. I definitely bill more now than I did when I first started, because I've learned a lot more about how to bill. It's kind of fun and it's really easy. And so it's like, oh, it's an extra like 15 minutes, kind of like balancing your checkbook, if you've ever done that, when you're young. But it's just adding those codes in and knowing the codes that you should be adding. And I'm happy to go through, I do these kinds of calls and talks with lots of different people showing how I do it. And this is what we do. And this is where I find the codes, and this is whatever. I mean, part of it's just having someone who's like, hey, this is what you need to know about it. But it's if you talk to anybody who does billing, they always tell you, oh, you need to hire a biller. It's way too much.
I see. Thank you.
Yeah.
I love how Hayley is so encouraging, and she tells us the truth. So for all of you that are here on the call, I want to thank you for being part of this. This is time that you take to learn, and I think this is very important for all of us. And I have to tell you that this group grew from 0 to more than 400 people, and there are many people like Hayley that were very, very interested to help. Thank you for sharing the email, Hayley, with everybody. I share my email, and Hayley share her email. So copy the emails and send us messages. I have to share with you at the end of the call. I started together with other bright minds this Direct Specialty Care Alliance, which the purpose of this was to unite all of us, to elevate all of us, and basically to bring us all together. We are in the process of building up the website, the directory of all of us that are in direct care, not only for the other specialists to find us, but for patients to find us. And I'm actively speaking, and I know others on the group are speaking, and I will invite other specialists to speak to you. But we are speaking at the national level. We have invitations to speak at the national level about what we are doing. And I think this is absolutely amazing, because finally patients will learn about us, and being united in this mission, I feel like it's so important. We started the group, we started the alliance. Yes, we sent some emails about joining the alliance. It's not mandatory, but it's going to be great if we come together to bring this vision forward. And if you want to be part of this, you are very welcome. If you want to contribute, you are very welcome. The website has a wonderful SEO. It's found the first thing when you look up direct care is this website that comes up. And if you're going to submit posts, blogs to this, it's going to be linked to your website. So I want to see everybody visible. And, you know, I'm going to continue this journey, not only me, but I know I have people like Hayley, that we are all dedicated in this mission to help others join us practice medicine to the level that you're going to feel fulfilled as a physician. So if you want to join, send me a direct message. If you want to contribute to this, please come, and you are so welcome. And I want to thank all of you for being here, and especially Hayley, who actually dedicated her time for free. Okay, you just have to know we are dedicating our time for free for people to learn and grow in this movement.
It's, I mean, it's all, I mean, this is how it should be though, too. Like, you know, we have this, we want everybody else to have, we want patients to have this kind of experience. And it's, you've done just a tremendous like amount of work to put this together and to kind of collate. I can't imagine there being as many specialists doing it now as there are without you. So thank you for doing everything.
I think I was able to inspire a few, and I'm very, very happy to see that and you inspire too people. So I know people like us can help others, and we should not have that mentality. It's only me. If it's good for me, it's enough. Or if it's, we have to grow as a community, because that's how nurse practitioners grow. That's how other communities grow. We have to support each other in this vision, because being by yourself, I can tell you, Hayley can tell you, is not fun. And not knowing where to refer a patient that wants direct care is not fun. I was struggling in the beginning to find a cardiologist or an endocrinologist. Now I know who to call, which is absolutely amazing. Patients are so appreciative to see this kind of care when you find solutions for them. And this space where we all gonna grow is for all of us, is not for me, is not for my benefit, is not for Hayley benefit or Lara benefit, or, you know, everybody that is here, is for all of us, because we all deserve to do our work. We all deserve to do our job and be respected. So let's face it, we should be respected for what we have done and what we have accomplished. And patients do not know about this alternative. So make sure that you speak up and you tell patients about direct care, because they will enjoy that and they will tell other patients, and this is how we're going to grow. And as I said, Rome was not built in a day, so we have to build that, and I invite you to be part of this.
I totally agree. The other thing is knowing that it's different than when you're in school or when you're working. I think that we're raised to, we're educated to be competitive, and like you never really have this kind of collegial, hey, let's help, unless we're doing some kind of group like team sort of thing. But it, like, every doctor that I've encountered are like, yeah, I'm going to help you. In this kind of environment, we can help, we can show, we can teach. And it's not like I'm giving you a trade secret. If you live in California, if you live in Ohio, or even if you lived in Montana, there's so many different people that it makes it's a much more collegial kind of environment than I've ever had. And, you know, it's different, not competitive.
And we're not in competition with each other.
No.
I think there is a huge gap that we have to fill, and there are enough patients for all of us.
Yeah, that's much better put than what I can say.
Thank you so much, Hayley. I highly appreciate. I'm very, very grateful. And thank you to everybody that took the time to be on the call.
Thanks for having me.
You're very welcome. Have a wonderful evening.